Hello, this is Dr. Doe again. This video is continuously from previous video, systemic approach for medicine. Basically, this series of video laying out like from the structure-wise, from the invisible major compounds, four major organic compounds, like carbohydrates, lipids, or nucleic acid, or proteins. So, and also the diseases associated with this metabolism of these major compounds, and then move up to the cellular level, and also diseases associated with the cells and the organelles, and also move on to the tissue level, which is visible, and for major tissues and associated diseases, which are either representative or serious or common. And move on to the organ systems. I start from different organs, and last time I talked about started cardiovascular system diseases. And when I talk about the respiratory system, I mentioned about the diseases, for example, cause the chest pain associated with the respiratory system. And the previous video talked about the chest pain that associated with the cardiovascular system. I use the example myocardial infarction, which is one of the most notorious, actually, so famous, everybody knows it, and also could be very serious. And the other causes of this chest pain from the cardiovascular system, in addition to the myocardial infarction or the coronary artery sclerotic disease, or actually on top of that, there's some other conditions might also cause chest pain. For example, the hypertrophic cardiomyopathy. The mechanism is because the hypertrophy of the muscle of the heart really enlarged, and the coronary artery running through the coronary grooves, which are the kind of, there's a subtle space between the muscle, between the atrium and also the ventricles. So during the process of the hypertrophy of enlarge of the heart, so the squeeze on those coronary arteries can also have this kind of similar mimic to the ischemic, so the chest pain with increased activities. So in terms of hypertrophic cardiomyopathy, there's some other like subvalvular cardiomyopathy, for example, obstructive cardiomyopathy, but these are the same idea. So in terms of the diagnosis, usually to evaluate the valve function, also the ventricular function by the cardiogram, so kind of visible, see how the heart function level, whether a heart can work efficiently to provide the perfusions for the organs and metabolism. And there's another cause of this chest pain associated with the cardiovascular system, the stenosis of aorta. You can imagine if the aorta, which is the first artery connect to the heart, like this, the trunk of a tree, and if this aorta is narrowed without, regardless of the cause, but if it is narrowed, so then you can imagine can cause this chest pain. It's different from the myocardial infarction, but still the pain is there, constant. And also there's another condition, is called dissection of the aortic dissection, which means the aorta going through long term of the sclerosis, and sometimes there's a torn or tear inside of the structure. Usually it's not complete, but the aorta inside is dissected, which means there's some damage over there. So you can imagine. So that's the case. It's a sudden cruciating chest pain. So if that's the case, it's quite dangerous, life-threatening. So these are the other major causes of the chest pain by the cardiovascular system. On top of that, there's some other conditions. Pericarditis, for example, it's the idea is similar to the pleuritis, but it's just the connective tissue that on top wrapping the heart. Of course, there are two layers, which is a visceral layer on the the heart and also the parietal layer on the other structures. So there's a subtle space in between. And this pericarditis could be viral causes, or could be part of inflammation from the systemic conditions. For example, lupus is a systemic inflammatory condition caused by the autoimmune mechanism. So, and pericarditis could occur. And for this case, the pain is also may associate with the breathing, and also positional. Changing position can alleviate the pain or can make the pain worse. So this is about, in terms of the treatment, I think depends on the causes. If it is the infection, then anti-infection management. If it's inflammation, then anti-inflammatory management. So this is another, for the physician, they can tell by listening to your heart. There's a rubbering between the two layers. And also, this condition is also could be serious when there's a fluid, particularly caused by the inflammation. The huge fluid between these two layers, you can imagine, so limited the heart dilate space, so then the heart cannot dilate, so that loss of function of the perfusion, pumping the blood. So this is another, this is a list of another group of conditions can cause chest pain. They have their own unique features and also share the common characteristic of the chest pain. So this is the chest pain that I can think of caused by the cardiovascular system, probably. And there's another one, it's may or may not associate with chest pain, like endocarditis. Usually endocarditis really do not have the chest pain unless on top of that endocarditis cause the valvular disease, cause the ischemic. Otherwise, endocarditis is not quite commonly associated with the chest pain. So this is about the chest pain associated with the cardiovascular system and associated with the circulatory system. So on top of that, and I also talk about dyspnea, difficulty breathing, when I talk about the respiratory system. So what are the causes for the dyspnea from the respiratory system, from the lung, from the pleural, for example. And also I mentioned heart disease also can cause this dyspnea, difficulty breathing. The nature actually is similar to the condition of the dyspnea caused by the lung, because the dyspnea caused by the heart conditions eventually end up with the complication of the lung diseases. I mentioned about pulmonary edema, for example, long-term hypertension, or any other heart conditions, cardiomyopathy, leading to the heart failure. So the heart failure leading to eventually the fluid back up to the lung through the mechanism, the blood vessels I mentioned, either the left atrium, or eventually the fluid cannot, the blood or the fluid cannot drain from the lung to the left atrium, to the left ventricle. So if that's the condition, then the dyspnea is associated with nocturnal, waking up at night, and also positional. You have to lift up the pillows in order to, the fluid will at the bottom of your lung. So I'm going to talk about more next video. Thank you for watching. I'll see you next time.